Hi, myself Dr. Meghna from HEMS Hospital. I would like to ask a question. Have you ever seen a bruise or bump on your skin that just won't go away? It might be more serious than you think. Imagine a cancer that can arise almost anywhere in the body and often with little warning. That's angiosarcoma. This video is to give you a clear and accessible understanding of what angiosarcoma is, how it develops, and its symptoms, and most importantly, how we can treat this rare and aggressive cancer via holistic approach. Angiosarcoma is a rare and aggressive cancer that arises from the cells lining the blood vessels or lymph vessels. Because it originates in the vascular system, it can develop almost anywhere in the body, most commonly skin, scalp, head, neck, and even organs like breast, liver, heart, and even deep soft tissues. Angiosarcoma accounts for less than 2% of soft tissue sarcoma, and due to its rarity, it is misdiagnosed or underdiagnosed, which can delay the treatment. There are several types of angiosarcoma depending on the location of tumor. Cutaneous angiosarcoma. Well, this is the most common form and generally appears on the scalp or face, particularly in older adults. Breast angiosarcoma, often seen in women who have previously undergone radiation therapy for breast cancer. Hepatic angiosarcoma, a rare but highly aggressive form that develops in the liver. Cardiac angiosarcoma affects the heart and is particularly dangerous due to its location and rapid growth. Its development in the body begins when endothelial cells, the cells which lines the blood vessels or the lymph vessels, starts to grow uncontrollably. The abnormal growth leads to the formation of tumors that are often fast growing and highly vascular. That means they bleed very easily. If we talk about the symptoms of angiosarcoma, growth like lesions that grows rapidly, swelling or pain in the affected area, skin lesions that are purple, red or dark blue, bleeding from the tumor site, and if the internal organs are involved, symptoms like abdominal pain, shortness of breath, and fatigue are usually seen. The prognosis of the disease depends on the location of tumor, its size, whether it has metastasized, and how early it is detected. And for metastatic angiosarcomas, the prognosis is extremely poor. And the main challenge that are being faced is its high recurrence rate even after surgery or chemotherapy. A lot of conventional methods involve biopsy for the diagnosis of this disease and giving it a stamp of confirmation along with the treatments like chemotherapy and radiation. But trust me, they all come with multiple side effects. If we talk about biopsy, the common side effects that the patient faces are pain and swelling in the affected area, infection, delayed wound healing, and in fact bruising and hematoma. That means the leakage of blood to the surrounding tissues. And something that is very important to note is the tumor seeding. That means the cancer cells might spread along the path of needle. Chemo and radiation too leads to certain side effects like organ damage, neuropathy, fertility issues, chronic lymphedema, and delayed wound healing. Now I would like to share the journey of a patient with you.
Today is the 23rd of March 2025. I had recorded a video earlier on the 1st of March. This is a close-up of her face. This is an old photo from when they first came to us. At that time, insects, maggots were crawling on her face. She had been diagnosed with a cancer called angiosarcoma.
Everyone said this cancer was very aggressive and incurable. The doctors told us to trust God, get the surgery done, and leave everything else to faith. So they performed the full surgery and wanted to remove everything. We didn't agree with that approach. Instead, we turned to Ayurveda and naturopathy for healing.
This video is about angiosarcoma, one of the most dangerous cancers. The patient is now going home healed. I hope this person becomes a role model for not only India, but entire world, showing how they fought and beat cancer that was diagnosed as final stage in 2 biopsies. Through Ayurveda, Panchakarma therapies like leech therapy and many therapies, naturopathy and proper diet, they healed. Nature is truly powerful. Along with her brother and Nisha Maniji, we will spread this message across India.
Meet Nisha Mani, a courageous woman from Odisha who battled angiosarcoma. It began with a small swelling on her cheek, which soon turned into painful and ulcerative wound after her biopsy, with conventional doctors suggesting radical surgery, potentially including her eyes, cheeks, and jaw. Nisha and her family felt overwhelmingly distressed. Instead of surgery and chemo, she opted for integrated treatment at HIMS Hospital. Notably, the wound, initially inflamed with pus and maggots infestation, started healing visibly within 12 days of the treatment, and that led to the preservance of the eye, recovery of the wound, and demonstrating possibility of non-surgical intervention in angiosarcoma. The holistic care at HIMS includes Panchakarma, that is the Shodhan or purification therapy, and procedures like Virechan and Basti helps in eliminating the deep-rooted toxins. Some usage of the herbs like Kachnar Gugar for lymphatic swellings, Haridra, that is turmeric, which is anti-inflammatory and antioxidant, Ashwagandha, all of these support the anti-cancer activity and have anti-tumor potential. The use of Rasayan like Ashwagandha, Guruchi, Amalki helps in immune modulation and dhatu rejuvenation. Diet modification that specifically talks about autophagy, in which the cells break down and recycle its own components. Lifestyle modification, yoga, and meditation. Nisha Mani's story reminds us that healing is not always about cutting deeper. It's about looking deeper. And sometimes the oldest sciences still have the power to write the newest chapters of hope. Thank you.